Hello everyone. So today I am here with you to share the international patient safety goals on goal number 1. So in this session we'll be covering of why we need to identify the patient correctly. So this is the first goal in our international patient safety goal. So we'll be using this patient safety checklist, or you can call it as the patient identifiers, by using the two identifier, that is the name of the patient, the date of birth, to identify, as well as the patient OP number or IP number, along with the patient ID tag and the patient record. When and all we are going to use it? Yes, before administration of any drugs, before blood and blood products transfusion, before taking the sample from the patient, might be it is a routine sample or any other sample for test, before other clinical tests such as might be bronchoscopy or MRI, CT. Whenever we do any sort of diagnostic interventions or therapeutic interventions, definitely we need to cross-check the patient identifiers, that is the patient name and the OP number and the IP number, along with the patient tag and the register. Pen and all, we are going to also use it like before any other therapeutic treatment, such as passing ICD insertion, or before any other surgical procedure, which is actually essential to prevent the wrong site or wrong patient surgeries. So in case of a neonate, also name the patient immediately after the baby is being delivered, along with the mother. So this is the mother tag which is being placed here, and also you can see the baby's tag over the baby's hands, which shows that they are of the same thing, and it is not going to malpractice it. We are not going to mix up the baby and give a wrong baby when they are going home. So in order to avoid that, immediately after the umbilical cord is being cut and before you start on with other therapy of the neonate, see that you immediately place the name tag. How does the patient identification improve patient safety? Is that it ensures patient data integrity, it improves positive patient outcome, as well as it reduces the medical records errors, it avoids the patient mix up, that is mixing up with other patient, it boosts the infection control efforts. So that's the reason why we all are planning in for patient identification to improve the patient's safety. So that's all for today. Thank you for your calm and patient listening. So if you have any doubts or any queries, don't forget to put it onto the suggestion box. That is the comment box. So always like this patient identification is not only before procedure or before shifting the patient. Whenever we go and communicate to the patient also, maybe you are on a wrong patient in a ward with the same name, Mr. Saraswati L, Mrs. Saraswati P. Might be two patients of the same name from the same area, but we might, instead of using the identifiers, we directly go and speak. Patient Saraswati M wants angioplasty and Saraswati L needs to go for a CABG. So you might wrongly go and explain if you are not using the correct identifiers. See that we are always using the perfect identifiers to avoid the risk for developing what to say the wrong procedure, wrong site, wrong patient, and others. So even when you're shifting the patient for diagnostic purpose or therapeutic purpose, confirm. Even if you know well the patient, also no problem, just confirm with the patient ID tag and your patient record, so that we can enhance increased safety. So I all humbly request all the nurses to always follow the patient safety in order to prevent many more medical errors, and we can give a good and improvised care to the patient. So this is the first and foremost goal in IPSG, and I also thank you all for your patient listening. If you have any doubts or suggestions, put onto the comment box. Thank you all. Please do subscribe and share the link. Thank you.